Thank you very much. So welcome to this meeting of Children and Young People Scrutiny Committee. The agenda papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is making a recording of this meeting, which will be uploaded to the Herefordshire Council YouTube website at the earliest available opportunity. Other attendees are permitted to film, photograph and record our public meeting, providing it does not disrupt the business of the meeting. If you do not wish to be filmed or photographed, please identify yourself so that anyone who intends to record the meeting can be made aware. Thank you. Got that. To ensure that recording quality is maintained, could members speak as clearly as possible, keep background noise to a minimum, and please ensure mobile phones and other devices are turned to silent, including laptops. Right. So, do we have anybody joining us remotely today?
No.
No. Okay. Thank you. We have a number of officers and other attendees present. I wonder if I could just ask you to introduce yourselves, please. I think it would be helpful to start. So, if we could start, please. Well, we might as well start with Councillor Powell.
I'm Powell, I'm the Cabinet Member for Children's Services.
Afternoon, everybody. I'm Tina Russell, the Director for Children's Services.
Hi there, Leanne, Low Detective Superintendent, West Mercia Police.
Afternoon, everyone. Natalie Solomon, Associate Director for Safeguarding Quality and Nursing at Herefordshire ICB and Worcestershire.
Hello, everyone. Angela Wilson, I'm the Business Manager for the Safeguarding Partnerships in Herefordshire.
Good afternoon, Kevin Crompton. I'm the Independent Scrutineer for Children's Safeguarding, and I also Independent Chair of the Adult Safeguarding Board for the county.
Thank you very much, and thank you for coming. Welcome. Have we received any apologies for absence?
Yes, we've received apologies for absence from Councillor David Hitchener, Councillor Claire Davies and David Willis of the Diocese of Hereford.
Thank you. And do we have any substituted members attending?
Yes, Councillor Pauline Crockett will be substitute for Councillor David Hitchener.
Thank you. Welcome, Councillor Crockett. Nice to have you here. Right. So, do we have any declarations of interest by members in respect to items on the agenda? No declarations. Thank you. So the minutes of the previous meeting, to approve and sign the minutes of the meeting held on the 16th of September 2025. Has anybody noted any points for accuracy? There has been a change in the way in which the minutes are recorded, but we'll get our head around that. So can I please move then that the minutes of the meeting held on the 16th of September be agreed as a correct record? Yep. You. I think that's accepted. Right. Have we had any written questions from members of the public?
Yes, we received one written question from a member of the public. A response to that was published and on the Herefordshire Council website.
Okay, thank you. And are there any supplementary questions?
No, there will be no supplementary questions.
Right. Okay. So, moving on to questions from members of the council. Have we received any written questions from members of the council?
No, we've received no.
Thank you. Right. Agenda item 7, which is the Herefordshire Safeguarding Children Partnership Yearly Report 2024 to 25. So this is to provide the committee with the Safeguarding Children Partnership Yearly Review of Effectiveness for the period. And we've got many members of the partnership here, and we've had a couple of meetings prior to this to discuss the annual report, look at the issues. So we're not asking for any presentation on this, but I wonder if I could please refer to the independent scrutineer, Kevin Compton. If you could please just give us a sort of little synopsis.
I can give you a quick cameo, yes.
Sorry, Kevin, but if I could just confirm, it's not a random representation of the partnership you've got here. You've got the executive group of the partnership. We are the designated statutory partners of the Safeguarding Board.
Thank you for making that clear. And thank you.
Thank you
for
for
coming.
That's fine. I think that would be an illustration, I would say, of how things have changed. So one of my fundamental jobs is on an annual basis to write a report about assuring people that the partnership working is effective. So the headline is very straightforward this year. For the first time since 2022, I unequivocally have said this partnership is an effective partnership. It was working towards it in 23-24, certainly got there in 24-25, and I will say a couple of points about 25-26 because we're now 7 months into the next year. And that's important because the trajectory is going from good to better. It's important to say. Why do I feel able to say that? Just some headlines. The governance is much improved, the subgroup working, the leadership, sparing somebody's blushes provided by the DCS has been exemplary. Has really focused the board and partners have responded well to that. Working relationships have always been good, I've found, between the various bodies here, but that's been capitalised on. In 24-25, clearly compliant with Working Together 23, which was a major piece of work for that year. And a major step that I think is very important is the education subgroup now functions and connects the good work that's done in Herefordshire schools around safeguarding is now reconnected with its safeguarding board, which in 2022, for example, was not the case. Some really good work on Get Safe, which is child exploitation. And I think I've mentioned before, when I see feedback from a service like that, where young people have been asked of the effect of the service on their daily living and they say, I felt safer, my life has changed because of your intervention, you're getting some clear qualitative evidence from children and young people about the impact on them. Data auditing, you have an audit library, you have qualitative and quantitative data quality that's being used as a tool to reflect on improved performance. You've always had an effective joint case review, so you're doing the right things by way of rapid reviews, adult reviews, DHRs. And I've often said this job I do should be very easy because I should ask the partners, how do you know you're effective? They should tell me, I've got this data, this got this stuff. And I should say, I'll quick read of that, say it's okay. I can do that now. This partnership has got a line of sight on practice. Very effective multi-agency safeguarding hub that's improved and it worked with the police and all the changes very effectively. Restorative practice is becoming the common methodology and language, which is really good because all partners are working from the same template. And that means that's good for families. Two big issues, the structure and function of the business unit and the budget have been sorted, and they weren't. I would say this, I'm chairing your adult board, but the alignment with other partnerships, the improvement board, community safety partnership, health and wellbeing board, I think all that inter-partnership working is strong. And of course, in regulatory terms, Ofsted's monitoring visits for 24-25 were increasingly positive. I won't go through all because they're in the report. In the end of March, I did indicate a number of things that I thought the partnership should continue to attend to. Keep the pace, continue to sort the data, keep the audits work. The Peel inspection for police had come about, organisational change in terms of the ICB was being announced. 7 months into the new year, I can say all those issues are being managed, and I'm sure you'll have questions on that. It's important to say that. In the last 2 weeks, I've sat in on the Section 11 challenge exercise. So every 2 years, all the partners are asked to contribute to an audit of their own effectiveness and their own responsibilities under Working Together 23. And they do a self-assessment, which they present to the Quality and Effectiveness Group. The first round of that happened a week ago, Monday, where Children's Social Care, police, health and health providers were the first to do their presentation. And the evidence from that is that very strong in terms of safeguarding structures and safeguarding work. And finally, as an illustration of how things have changed, I I sat in on the joint quality and effectiveness group, which is now convened with Worcestershire, and watched the two authorities, including Herefordshire, compare their data, compare their practice, and clearly begin to learn and gain strength from each other going forward. So, as I say here today, this is a partnership that's grown in strength and is showing signs of sustaining that strength going forward.
Thank you very much. And it's great to hear that. I mean, we've sat here a couple of years now. You know, the first time that you presented to us, it was looking really quite bad for the partnership. So it's wonderful to see the work that's happened over the past couple of years to bring it to this point. Obviously, as a scrutiny committee, we welcome that, but you know, we've got a few questions in terms of some of the issues that have been identified. And when I was thinking about this meeting, I was looking at the ministerial forward to Stable Homes Built on Love by David Johnson MP, who was saying that our aim is to create a children's social care system which prioritises love and stability for children and families relentlessly. And that sort of struck me as quite an important part of a piece of work that underpins the role of the Safeguarding Partnership in Herefordshire. So that focus on Think Family, which I know has been identified as one of the priorities really for the partnership to work on. I think that sort of underpins a lot of the questions that I have. I'm not entirely sure whether Think Family has been sort of properly embedded in the partnership work yet. I imagine that something like that takes time. So I have some questions around that, but I first of all just also wanted to refer to the Peel report, because that is one of the things that has leapt out. And I did see today that there had been an escalation, accelerated cause of concern in terms of the safeguarding referrals to statutory partners to keep vulnerable people safe. And I just wondered if you would just like to sort of respond to that on behalf of West Mercia Police, because although it's not very clear whether that refers to Herefordshire or specifically, but it is, you know, it is the West Midlands Force. And so I imagine that there's an extensive work happening within West Mercia Police to address those safeguarding issues.
Yeah, so it was West Mercia wide. For Herefordshire specifically, backlogs in relation to safeguarding referrals have always been very low, and I'm pleased to report that there are no backlogs at all for Herefordshire as I sit here today. But there is extensive work, so we've prepared an action plan that we've worked through with our partners. We've shared that feedback and received feedback from Herefordshire, and we're working through each of those actions, some of which are significant, to ensure that we are effectively meeting our statutory duties to safeguard children. And HMIC FRS are back with us throughout November and December to work through the action plan with us to make sure that we are meeting those duties.
Okay, and is that action plan, is that sort of available to see publicly, or is that?
No, it's not published publicly, but it is shared with our partners.
Okay, so the partnership is aware of it, yes, and they're effectively working together, yes, to make sure that children, Herefordshire children, aren't impacted by.
That's right. Yes.
Okay, thank you very much. Yes.
Could I just ask, refer to the Peel inspection, is Peel an acronym, or is Peel, does it refer back to Sir Robert Peel? And could you just, for the benefit of people watching, could you explain what the Peel inspection was?
Efficiency and effectiveness review, essentially. That's, I can't remember what the L is, good test. Legitimacy, yeah, that's it. So it is an acronym that's used, but there's like a rolling process of Peel reviews of policing.
It's just coincidental that there was a Sir Robert Peel.
Oh, I think probably not. I think somebody really clever came up with that, but
made the acronym from that.
Yeah.
Thank you.
Yeah, maybe you go.
Yes, Councillor Crockett and then Councillor Hayfield.
Thank you. I'm really sorry, I've forgotten your names.
Leanne Lowe. Leanne.
Yeah.
The nature in dark.
Yes. It is dark over there. Jan, thank you for coming today. And I note from the report that in the past it's been Helen Wayne. So is Helen, has she changed roles now? Are you going to be permanently?
Yeah, so I'm the safeguarding partner for Herefordshire and Worcestershire.
Perfect, thank you.
And just to reassure, Leanne's been part of the designated safeguarding group for at least the past year, if not more, anyway.
Right.
But we've also had Helen Wayne. So in the reorganisation, Leanne's just been named as the partner instead of the two being present at the meetings.
Okay, it was just, you know, when I saw the authors of this, it was yourself, Gina, Helen and Jack Cobain. So, you know, just wanted to understand the background there. So the other thing that's pretty simple, I think, is just looking at about the area profile on the item 3 on your paper. And it's saying about the population, the current population from the JSNA, Joint Strategic Needs Assessment, for anybody who doesn't like acronyms. The current population in 2023 was 189,900 residents, but 194,500 registered with GPs patients. So I just wondered that 4,600, is it because people are coming across the border? Do you know why the figures don't tally on that figure 1 population?
I don't know whether Natalie is in a position to answer anything specific on that, but it won't be specifically about that one element at all. It will potentially be a whole range of people that have moved in and are yet to register with a GP. I'm not sure whether there is.
But there's more GP patients than there are residents on this slide. Yeah.
I think.
Oh,
Because I think the explanation is the same. It takes time to take people off registers, therefore surgeries. I've seen this elsewhere, councillors. So GP surgery numbers, registrations can be higher because of the time it takes for movements to take place for all sorts of reasons. There is a time gap.
So the figures might reflect that in next year's annual report.
It probably would, yes.
I think a number of people sometimes registered temporarily with the GP as well, while they're on holiday or while they're here, don't they? And then whether or not there is a fast time system for them to be removed from GP practice, I don't know.
Yeah, I'm sure it's not an easy thing to keep track of people.
I think Natalie, do you have?
Oh, sorry, it's going to concur with Kevin and what Tina was saying in terms of the temporary registration, and also there's a cohort of patients sometimes that are registered separately. It's called a special allocation scheme. So there are vulnerable patients that are sometimes placed there, so it's not necessarily a permanent GP registration. So that could be one of the reasons.
Okay, thank you.
Councillor Highfield, did you have a question?
Yes, I have one. And arising out of your summary, I heard you say privately that there's still work to be done. Where would you say, I don't know who wishes to answer, but where do we need to focus our work going forward? What's your primary targets now?
Well, I think we've outlined those in the business plan, which we attached, and we put people, leads and timescales on those business plan from feedback from when you did previously. But we had a couple of workshops where we went through what are our priorities going forward, and that's what we've outlined in terms of our action business plan going forward.
I've just got another question for Leanne. So, and this may have been resolved, but I was reading there that at the end of 2024-25, the police missing coordinator post in West Mercia Police became vacant, and the post was being covered by other officers to minimise the impact. And I just wondered whether that role has actually been filled now, or if there's still an absence in that role, and does that create a vulnerability within the sort of.
So I don't know specifically, but I do know is that the role has changed. They're now called care home and missing officers. The force is going through a restructure, which will go live in January of next year. But those are now care home and missing officers. I can't sit here and say they've all been recruited to, but I can certainly find.
Okay, thank you. Yes, councillor.
Just sort of following that, one thing that I'm interested in is the sort of nature of public services, that they're constantly changing, and each organisation will be reorganising its structures for funding reasons, for operational reasons. So how, as a partnership, how do you kind of keep track of that? How much influence do the different partners? Because obviously we're only Herefordshire, West Mercia is bigger, the ICB is bigger. So how much influence do different partners have on how the other partners shape their structures, and how do we respond to those changes?
I start. So if I talk about my partners and their reorganisations, and then they can tell you about my reorganisations. So certainly from a local authority perspective, we feel very well informed and engaged, both with health and with the police, both operationally and strategically. So we have very different groups, but so senior managers operationally, but obviously the most senior at strategically. We are always invited to comment on action plans. We've mentioned recently the inspection action plan. It's really good in the way that it recognised and picked up what the partnership are doing to achieve against that action plan. So it didn't come across as a plan that the police have just done by themselves. I have seen where I've fed back and that's directly influenced. So I think there is absolute influence in there. Another example is as a local authority, we requested that we create the PEG group. Can't remember what it stands for off the top of my head. Partnership Executive Group. That was a request of the local authority when things weren't progressing well with the improvement plan. That was immediately accepted. Both partners stepped up. That was Chief Executive and the Chief Constable. And meetings were put in place. I'm really pleased to say over the last 18 months, we've not had to escalate anything to them because we've been able to resolve it. But it's an example of how the partnership have stepped up. We've had Chief Executive from the ICB at both Cabinet, and also we've had feedback from partnership meetings. So we look at the safeguarding partnership around what the impact is going to be, what the changes are going to be in great detail, actually, and we really scrutinise that and we feed that back in. So I think for me, I feel very informed and engaged with the partnerships. But equally, we, and I hope that they say this, but as a local authority, we also understand that they are big organisations and they do need to go through change. And sometimes that creates turbulence in organisations. I know I've experienced that myself in the past, and we need to support that turbulence. And that's very much what we've been doing with the HAU redesign, supporting that turbulence. We have seconded social workers for a couple of weeks to help police when they've got new staff coming in who are learning thresholds, for example. They put in additional staff when we've said, oh, this little backlog has just creeped up, we don't want this to happen. They've immediately put in additional staff. I've even challenged on, don't put loads of staff in at weekends for us to come in and deal with all the problems on a Monday. And Leanne's like, no, we'll pace that through. So there's real tangible examples of how we have escalated, the services responded, and you know, and for me, a healthy partnership is one where you can have that challenge, and you can have that recognition and support. So, and I think that we've absolutely got that. So that's for me and how I've experienced there to change it.
I would agree. And I also feel very lucky that with Herefordshire, I know I can pick up the phone to Tina and her team if there's an issue, and it gets resolved quickly and talked about quickly. So,
agreement as well. I would say also that I mean, as an ICB, we're obviously going through a period of instability with the restructuring. But as a partnership, we've actually been giving updates and actually been asked to provide an update on what that will look like and how we will ensure that the statutory partners will be around the table. And our chief executives are also a lead safeguarding partner. So I think having those conversations around the table have also kind of made sure that we keep connected with what the partnership work looks like as well.
And I think a really another good example as for us as a partnership is when Natalie replaced Kath Cobain, which was the name that you saw. Again, Natalie came for a few meetings alongside Kath Cobain, and then Kath stepped away. And as a partnership, we challenged that and we said, okay, so if Natalie's now going to be the designated partner, has she got the accountability to make decisions? And I think it's fair to say, Natalie, you said, oh, I don't know, I better go away and check that. And we made that demand. We said, well, if you haven't got that authority, then you're not the right person to be sitting around this table, because we have got that authority and we need to make decisions, and we don't want to be delayed as a partnership because they've fronted somebody that's not got that authority. And you went away and we got that letter in confirmation that Natalie had that authority to make the decisions on behalf of the partnership. So again, it was a really good example of we challenge but we work together.
Thank you. Yes.
Thanks, Gina. Looking at strategic effectiveness and leadership, it sounds like the partnership is working really well and everything is getting, good comments back to each other, and meetings are progressing as they should. But has the independent scrutiny identified any areas of concern or good practice?
Not recently any concern. So I've not had any intervention in terms of any individual case, which wasn't the case 2 years ago. And areas of good practice, get safe. As I've said, clear example of the partnership gripping the issue of child exploitation, the work equality. A lot of amazing work being done through children's social care, which is reported primarily to the Improvement Board around working with families. Lots of evidence that good practice is creeping in there, and better decisions are being made with families, and families are being done with rather than done to. So I think there's evidence there. I had sat in on one of the audits done by the partnership, and if somebody's asked, what would I look at to learn from Herefordshire? I'd look at the way the partners now do their multi-agency audits, sharing of information in individual cases, very good challenge and debate. That's all really good practice. The council mentioned, what needs to be improved. Well, someone like me, you're always looking for the next step, as it were, next thing. I think continuing the work to evidence the impact on the lived experience of families and children is a challenge for every partnership, constant challenge, because some of it we do an act of faith working with families, more evidence about what works. Yeah, we had a little. I had a little wobble when I read the Peel report and thought, must rush up and thought, where to the police? But it is all in hand. The partners have gripped all that, and it's not that anyone's denied there was an issue. It's the way the response up to the issue. And of course, the other thing going forward is we're all aware we're in one of those difficult public service budget situations, and sustaining safeguarding practice, keeping that a priority. And that's a shared challenge, isn't it?
You already mentioned that we're quite a way through this next year. So are your comments really standing for what you've experienced so far this year?
This year, as I said, if I gave you my report on this year, it would be the same as some of last year, but also where further improvements and things have got embedded. And there's been less churn, I think, across the members of staff and colleagues involved in the partnership, which has really helped as well. And I said I probably would, and I will write at the end of this year a bit more about the way the work with Worcestershire is going well, because that's a sign of a good partnership, learning, but not just learning from another partnership, actually taking learning to the table, which was really good to see. So yeah, I'm looking down. I would say this. There is some good work going on between the Adults Board and the Children's Board. I think Tina would agree, and that's really important. So there's been an audit of children exploited as they cross from 17 and 11 months into 18, which is enabling the partnership to examine how well we manage that particular line of transition. And that's been driven by a joint partnership group across the Adults and the Children's Board. So that will be a little flag to wave in the report next year.
Thank you, Kevin. And those comments are really important because, we will be following this next year we can see how it all pans out. Thank you.
Thank you. I just want to refer to Natalie, and there was one of the issues for the Hereford and Worcester Healthcare NHS Trust risks was on the safeguarding register, which was about the information in a timely manner and risk of abuse or neglected children inappropriately assessed or mitigated. Now, as far as I understand, those issues, the report tells us that those issues have been resolved. I just wonder if you can just speak to that for a couple of minutes, give us that assurance about sort of what measures have been taken and what the case is now, please.
Okay, yeah. So the Health and Care Trust have a quarterly quality and safeguarding meeting, which is attended by the ICB. So we obviously challenge and support them through that meeting in terms of measuring the KPIs and looking at what kind of systems are put in place around risk assessing for children and adults who are safeguarded. So we attend those meetings and we obviously can offer any challenge at those meetings. So what we do know is that the current position is they've just done an internal assurance audit to sense check where they're at with that. So the CQC inspection was 2023, but the report was published in January 24, and they've made a lot of progress within that. So we're assured that around their safeguarding structures and the governance arrangements they have in place, with us obviously being part of that, we're assured that they've made some really good headway around that.
Okay, and so basically the quality assurance that's happening, that process is constant, looking at issues like that and sort of making sure that the issues are addressed.
Absolutely.
That's what's happening. Thank you. The next question I had was really about the localities model and how well does that model strengthen frontline partnership working and accountability at the local level. So is that transition to localities working and how the partnership is sort of integrated with that? Possibly, Tina, you would like to.
It doesn't strengthen accountability, because accountability is accountability, and it's the same whether you're delivering a central service or a service from a locality. That's assuring, not assuring. But in terms of how that's working and enabling those local practitioners across those partnerships to come together, absolutely. I mean, we haven't got a report that we've done on that, but the feedback is very much, I think you heard last time, Helen said, the local police are able to pop into the locality base. The people know each other because they're locally based. The work that we're doing through the Families First programme, which you kind of referred to, the Families First programme is really the implementation arm of that Stable Homes Built on Love. And so that's very much around engaging that universal, the voluntary sector, the local services that are around, and getting those partners to know where their social workers are, who the local PCSOs are, the local health centres that probably people already know, but it's having opportunities to connect those people as well. So it's working very, very well.
So in terms of the partnership and the Families First programme, is the partnership actually sort of, does the Families First programme sit underneath the partnership, or is that something that the council
does the safeguarding partnership?
Yeah,
no, it doesn't sit underneath the safeguarding partnership. It is a multi-agency partnership. There's a steering group for the implementation of that programme, and that is a multi-agency partnership that we've got. That partnership, the governance for that partnership, who is overseeing the implementation of that programme, sits within our strategic young people's strategic partnership, because that's the multi-agency partnership, which is a wider multi-agency partnership than the safeguarding partnership, because it has got public health, it has got the voluntary sector, it has got the diocese, for example. All of those are on that wider partnership. So that's why we put the governance of the Families First programme under that partnership. However, it also feeds into the safeguarding partnership. So we get updates at the safeguarding partnership on our agenda, and we will particularly focus our updates at the safeguarding partnership on the element of the Families First programme, which is the development of the multi-agency child protection role. So there is a child protection role, which is really the banner of the safeguarding that will come into much more detail here, whereas the wider programme is much more about family help, early help, as you talked about at the beginning, and that is the right place to feed into the Children and Young People Strategic Partnership.
Okay, I've got a sense of it. So the Think Family approach, which in my mind kind of sits within that framework anyway, is how is that being implemented sort of across the partnership? So how are the different partners sort of taking Think Family on board?
So in terms of it, I mean, it sits really within where and how the partners are doing assessments. So the Think Family is think wider than the child that you're doing that assessment on. And now that might be a social work assessment, or it might be a family help assessment. And we're currently the aims of the Families First programme is that there is no level 1, wall level 2, wall level 3. It's a much more fluid process, which is right, because that's what children could sometimes come up in terms of the level of intervention they need or go back down. And instead of having a early help assessment or a children's Section 17 assessment or a child protection assessment, it's seeking us to have much more of a one assessment, a single assessment. And we're in the midst now of co-producing that single assessment. We're also co-producing a self-assessment, a family self-assessment. So we've listened to the feedback from parents that will often say, when the social worker's done their social work assessment, or in the early help assessment that any of the partners might have done, yes, I've contributed, but all of the things that I said and the authenticity of my story and experience isn't fully captured. So we're developing a self-assessment that the parents can write themselves, a much more interactive assessment, and that will become part of the social worker's assessment or that family help assessment. So that, and I think it will be really helpful, because I think when you do read the story and the experience in the family's own words, it is far more impactful, and even the best professionals can only ever try and capture what that's like in a wider assessment. So and both of those assessments, the self-assessment for the family and the single assessment, have got the think wider family, think family. So instead of just thinking about the child's needs and how the parent is meeting those child's needs, this parent and that parent, how are you? They ask you to think about who else exists in your family and friends network that might help you as parents and ultimately enable your child to be happy, healthy and safe, in simple terms. Who else is there? Is it granddad? Is it your next door neighbour? Who is helping? And what do they need to help them help you as a parent? Or what can they do to directly help your child? So a really common example will be, as a child, I've got a great relationship with my grandma, and it's really important as part of me having a safe person to go to, that I regularly go and have contact and see my grandma, for example. So that's all it's doing. That's what the Think Family approach is about, and that's being embedded within that new single assessment and the self-assessment that we're developing.
So how is it relevant then to the different partners? So, for example, to the police and to health, where is their input?
So their input is their awareness of when, for example.
Sure. So policing, I think, historically, we get called to something and it's right, got to take action. With the police, we've been called out to do something. And actually what we're saying to police officers that are going out to these jobs is stop, pause, think. You need to phone social services and talk to them about it. If that child is in immediate danger, of course take action. But if not, and it's a family that looks like they need help, let's speak to social services. Let's talk to them and understand, like, how can we help this family without escalating strict things like police protection. And I think that's when we're talking to our officers, it's around that stop and think, have some professional curiosity.
Yeah.
What does this family need?
And that Think Family in the minds when we're launching that is that when that frontline officer's there, they feel that they have got permission, because it is about Think Family, to say, have you got a grandma? Have you got an auntie? If things are falling apart today and clearly you're in a bad state, you can't cope, who else is in your family that might help this weekend or today or tonight to help them? Whereas previously, if those workers weren't thinking Think Family, they may think, all I can do is to address this emergency service is ring EDT or ring the social services, and they will need to sort out what should happen. And so it's just, for the partners, it's much more around, you know, giving them the thought process for that's what we want to do, that's how we work with families, and enabling them to enact on that. And similarly for health, for example, what we might say is, Natalie, if say that a case had been escalated and we had a granddad who was a really good support to a child, but granddad had got a disability. And one of the things, he'd been on a waiting list for, I don't know if I keep looking over there, you want to write about you know, and he, you know, he's been on a waiting list and he needs an occupational assessment at home. And we might say, actually, he's on the waiting list for an occupational assessment, but actually, do you know what, Natalie, working down the line, what we really need is we need to pick this up, because this granddad getting that access in and out of his house for him to be able to support the mum to look after that. I mean, that's an example of how, and if the service of health know that granddad's role in that child's life, it's all about Think Family, and doing that quickly means that they can be that support network within the family group conferencing. So that's the other thing that we've developed as part of Think Family, as part of Families First, as part of the work that we were doing anyway, widening that family group conferencing, that early help. We're not here as a service to make you as families dependent on us. What we're here to do is to help you first and foremost work out how you can parent your children well. And if that means bringing you all together and resolving some problems or identifying who can be part of the solution, then that's what we do. And you know, we've got data and reports around how much we've increased that offer of family group decision making to that wider family network. So you know, it's really important, and I think what we've done well here in Herefordshire is that they're not all new distinct programmes. We are coordinating them and making sure that they talk to each other. And one of the biggest challenges within the Families First programme, and the biggest opportunities that legislation gives us, is don't change what's fixed. Think about the outcomes that the Families First programme is trying to achieve for children, and that is that they are well looked after at home within their families. And that's what we're doing, rather than going, right, okay, this in isolation, this programme on its own means we should have a new job for a new child protection officer. Let's create that job and just stick them into the organisation. We're not doing that. We're looking at how all of these, single assessment, how all of these things are developing together. Single assessment needs development within the children's social care case management system in order that we can adopt it, be able to input the family's self-assessment within that without it having to be duplicated. So we're linking all these programmes together.
Thank you. And Natalie, from the health perspective, has that been an easy transition to make, or is there still considerable amount of work to do?
I think what we do in across the health system, so that's obviously with the health providers as well as Wide Valley Trust and the GPs as well, is we're just setting up a little bit of a steering group that feeds into the Families First Partnership group, operational group. But what we've been trying to focus on, what do we currently do well in terms of supporting families under family health? What do we do in terms of early help support, and what could we do differently that improves the outcome via Families First? So we have started to have those conversations, and I think with the restorative practice model that health have also been involved in, they're actually on the trajectory to get there. So we're working and doing in partnership and taking that collective responsibility for safeguarding. So I do think we're in the transformation phase, but I think health are on that journey as well with our partners and police.
Thank you. Yes.
Just so what Tina, the sort of examples that Tina gave for how Think Family might impact on the police health service sounded really sort of great. That's what we should be doing. But just reflecting about that, this may be my prejudice about how the health service works, but that example of accelerating granddad up the queue on safeguarding social care grounds rather than on medical grounds. How easy is it going to be for the system to adapt to that?
I think as part of some of the conversations we've been having is actually looking at those examples. So for example, if you've got a mental health provider, for example, where you know that you've got a parent or a grandparent that are part of that service, we are engaging mental health, adult mental health, as well as CAMS to say, right, if this is the situation as a health system, how do we get together and try and look at it across the family? Whereas I think historically we've probably just looked at the child, we'll be looking at the whole family. So there's going to be a whole load of work that needs to be done as part of that, but we're starting to have those conversations and engaging in what those processes then need to look like.
And asking the questions the other way around as well. So when adults become part of services, mental health services, for example, making sure that they've always asked the question, are you a parent? Do you have a role in the care of a child? And taking that into consideration when they're looking at how they are working with the adult individual.
Can I ask a data question? Or just so that we have a section on data, which for some reason has been given to me. I don't know why that is.
It wouldn't be scrutiny without your data question.
But just following on this think family conversation. So how will the partnership know if this is starting to work? These are quite sort of, these are like the individual decision made by a GP or an OT or a police officer or a social worker. So how will you be able to tell that it's working on, or the areas where it's not?
I mean, I guess one of the areas is that it is about how many families can we help at that lowest level that don't escalate. And if we are meeting the needs of those children through that family, and we give you the data on how many family group conferences have we had, how many of the outcome of those family group conferences, decision-making conferences, have resulted in a family plan that have meant that that's been resolved and closed and not escalated into the service. That will be one mechanism of outcome data that we look at. But it will also be, you know, how many cases don't escalate into child protection, how many children can be rehabilitated home. Those are all relevant data in how we're supporting the family to care for their own children.
Sorry, can I add, please? Just in addition, one thing that we're doing is through our audit program is having a key question in all of our multi-agency audits around whether we see evidence of think family approaches and how that's had an impact for the family. So we are looking for that evidence through different means other than data, through the audit programs. And I know some of our providers, for example, the Health and Care Trust, are including that question on their one of their internal audits that they're doing as well. So we're looking for that evidence through the audit programs as well.
And in children's social care, we have as part of our audits a whole section on quality of partnership working, and the supplementary questions within that are: how's the partnership working? Has the partnership come together to support and think family? And so that will draw out any problems or escalations for them as we're individually looking at case reviews. And we also ask the question in our service user feedback: how do you as a parent think the partnership work together? It'll be the operational partnership, of course, but we're asking parents and carers that. How did it work for you? Did you think the partners work together?
Thank you. One of the questions, as we're talking about families, and one of the bits that came out of the report was about parental acrimony and the potential for a mediation service. And I realised that we're going into even more straitened time than currently exists. So I imagine something like a mediation service. Well, it seems like a sort of an extra that is not essential, but given how parental acrimony can actually escalate in child protection, I just wondered where that need for a mediation service actually sits and whether it will become a priority or
so
not.
It is a priority for the reasons that you say. We identify it very much as an issue for us in cases that we work within children's social care. We had a government grant of 30,000 in order to look at a parental programme supporting separated parents. We have already got a contract with Venture, who are an early help provider, that they provide our kind of targeted early help. We've done a contract variation already, that's been completed. We topped up that as a local authority. I topped that up from our budget because it's a priority. And that service went live this week, I think, the beginning of November, to specifically work with separated parents who were trying to co-parent but are in significant conflict, that are coming through our door, whether it be at the front door post-assessment or have escalated to child protection, and things have been managed and resolved, but we recognise are resolved on a fragile basis, and we think that those parents are going to need some continued work together to be able to communicate in the interest of their children. So we've got a very, very clear contract as an extension with Venture to work with. I think it's 40 families each year to make sure that we can either step them down after assessment or step them down from service intervention. So we identified it and we funded it.
That's fantastic. That's brilliant news. Thank you very much. Yes, so Councillor Highfield, then Councillor Crockett.
Thank you. I'm very encouraged with the families first, because I think we all agree that perhaps years ago we focused too much on the child and not enough on the family, caused problems. So this is great. We got a briefing a few days ago about child exploitation, sexual and criminal. And there's an agency that's been commissioned to work with those young people who are in the early stages of exploitation. They're not the ones who come into the court system or anything. But what was a bit concerning was that in their work, they don't have any or almost no dealings with the family, with the parents or the carers. And when I asked them, well, how do you seek help for the families or carers, they were rather unclear. So are you aware of any holes in the system whereby, because if you've got a child that's being exploited, there will obviously be a family problem somewhere there. How is that to be dealt with under this Families First programme?
Was the agency you were talking about Catch 22?
Yes.
Yeah. And so
they're doing great work. I don't want to criticise them.
No, absolutely.
They were very
absolutely
separated from the parent side.
Yeah. And I guess that for many families, there might be a problem within the family, as you say, but actually the families might be the solution. There may be no, the exploitation of their child is completely separate to the quality of the parenting that parent is giving. Yeah. Absolutely. But you're right. Whilst Catch 22 don't work with the family, they will be feeding back into the family, whether, you know, things are going really well and we've done this and we've done this. So it's not that there's no communication there, but where there are wider issues of concerns within the family, that will very often be subject to a early help plan that is being led by the local authority or by Venture or by another agency, or even a child in need plan. So the Catch 22 could be a part of a wider plan if there were wider concerns within the family, which is why they might be reporting that they don't do that wider work with the family, because that's not what they're commissioned to do. They do that work with the child. But where there isn't that wider plan in place, they will be communicating back with the young person and the family. This has gone well, we've done this, where there's not wider concerns within the family. Okay.
And I wanted to ask a question, if I may, about the voice of the child, which is part of the issue. When you, and I know, and I have to congratulate both you, Director, and the Cabinet Member. I know you talk to families and the children as well. But how is that reflected in the programme? How do we get the identified feedback from children into the programme, and how do we identify that? What's the process by which that works?
Into which programme, sorry?
Well, your overall approach must be coloured by what the young people are saying, by what the children are saying, because that's the point of the voice of the child.
Yeah.
So how do you use that information?
So I guess there's a range of ways we do it. Case by case, we always talk to children and young people about how they are. As part of our audit of cases, so we case by case, that is there, and that is something that the managers will make sure that the workers have done and look at how the case, so the direction on a case can be influenced by making sure that spoken to the child and what the child has said. So that's kind of case by case. In terms of how we have that at the next level up and understand it and collate it. Voice of the child is also a specific section on our audit activity. So for all the cases that we audit, some 30 odd cases, you know, a month, quarter, 30, yeah. We look at what have we heard about the voice of the child, and we take the learning from what children have said in terms of that, what we need to do. If children are feeding back that they are unhappy or unsafe or feel anxious, that case by case is fed back, but we take that as organisational learning as well about what children and young people are telling us. We have just completed the Children and Young People participation strategy. And I would say that this is an example. Many strategies are often written first and then they are implemented. Our participation strategy has been informed by a lot of the work that we've already been doing over this last 12, 18 months. So we've now got that participation strategy, but in it is the intention to develop more connections and a wider group. So we've made a connection with the Hereford Youth Council. So the participation manager, so we've created a new post and we've funded a service manager for participation. She and I've already met Emma, but she and I are going out to meet the Youth Council. But within that strategy, we've also got a business case coming later in December to develop a youth shadow cabinet. And that's a real vision that I would like us to be able to have in place, because that gives that young person's voice, a consistent voice at the table. And I would like to see us develop that youth cabinet so that they can have, and we've talked to John and Dan about them having, you know, their own constitution and a role where they can feed back, not just on children's services, but on council developments and things. I can say in practice, you know, I'm in our CLT, I'm in cabinet briefings where people are talking the voice of the child. So that work that we did at Scrutiny, where we looked at who else is asking for the voice of the child, it's really landed, because the examples are coming up. We just talked the other day about the bypass. And we were talking about, you know, how do you get children and young people involved in the bypass? Well, you know, if you say to a lot of young people, do you want to know about the bypass? Many of them might say, not really, no thanks. How does that affect me? But what we know that young people are really interested in, because we hear this in terms of the wider voice of them, is that they're really interested in the environment. So if they hear about the bypass, one of their concerns might be, well, what's the impact going to be on the environment? And so, you know, Councillor Powell had the idea of saying, you know, why don't we've got to plant trees, I think it was, wasn't it, as part of the, to address the environment issues as we're developing our roads. Let's get the children and people involved in that, because if we ask them, do you want to be involved in a nurture nature event that's associated with the bypass, then they start to ask questions about the bypass, and then we can ask them the feedback with that. It's a long-winded example, but what I'm trying to give the example of is that these conversations and ideas are now coming up at these meetings and events. So if we can develop a more formal link, you know, to a kind of a young person shadow cabinet, I think we automatically go to them and ask them, as well as targeted audits, asking children and young people their views. The Children and Young People Strategic Plan has got a measure in there around children and young people telling us what it's like to live in Herefordshire through the health survey. We have the regular annual survey through schools. So using all of those different mechanisms that exist really to hear not just what children's social care and education's through education say, but the wider group. You know, those things are there. We've got plans to develop them where they're not there through that participation strategy as well.
That's me done. I'd just like to comment. I'm very pleased that you're not limiting it only to your field of children's services. That's great. Thank you.
Thank you. I mean, that is hugely exciting what you've just said, and it really, you know, the Scrutiny Committee has really been sort of pushing for that voice of the child sort of throughout policy. So it's really great to hear. I know that Councillor Proctor has a question.
The first thing is, I don't think it's strictly an interest, but I ought to state that I'm a volunteer with the City Youth Council, which you talked about the City Youth Council. I was just interested because you talked very coherently about what the council was doing, so I'm just interested in what the other two partners are doing, and I guess because this is the safeguarding partnership specifically to make sure that we're listening to children's experiences of health and policing in the context of safeguarding.
So in terms of policing at the moment, our focus around the voice of the child is very much around police attendance at incidents and capturing the voice of the child to inform risk assessment, so that when we are talking to our partners from our vulnerability hub, we can talk about that child's lived experience within a household. And it's not necessarily everything that the child is saying, it's but what else can you see and hear when you're in a household that will help to inform our partners around how do we keep these children safe, and hopefully in their own homes. So at the moment, that is our absolute focus around the voice of the child, and making sure that we are submitting good quality risk assessments around incidents that we attend. And I'm sure that will evolve at some point into a more proactive approach to talking to children about policing. But at the moment, our focus is very much around capturing that voice of the child when we attend it. So
just, you said you were sure at some point it might evolve. Is that actually something that Force is planning, or?
So not at the moment, no. I think we need to, we are very much focused on our statutory responsibilities as an organisation in keeping children safe. And that is where all of our efforts and focus are at the moment. And I think, it will evolve, but we need to make sure that we're getting it right at the front door at the moment. And that's where our focus is.
In terms of health, so as an ICB, we have a children's commissioning team who do lots of co-production work as part of their commissioning intentions. So that will obviously continue in the new world of the ICB. From a safeguarding perspective, quite like Leanne, we need to do something more moving forward. So we haven't had any specific focuses on engaging with children and young people from an ICB point of view around safeguarding. So that will be something in the near future. In terms of health partners, so Wye Valley Trust, for example, they have patient engagement teams and service user involvement through their trust processes. So they will do that as an independent health provider.
And how, so you're the partner on the partnership board, so how does the ICB ensure that those mechanisms are contributing to safeguarding? And because it would be potentially easy for, there's a lot of bits of the health system, it would be potentially easy for bits of the health system to go, yeah, it's going fine. So how do you assure yourself it is going?
Okay, so we attend their quality meetings. So each health provider has a quality and patient safety focus within their meetings, and we attend those as an ICB. So we get assurance through that route.
And do they have voice of the child as a standing item, for example?
It's not a standing item, but they do have targeted pieces of work, perhaps where they will engage with children and young people, and that comes through their forums and groups.
And I think it's a good example that takes us full circle to this partnership, because Natalie knows that when we have a safeguarding meeting and we want to talk about the business plan and how we're doing Think Family, we will come to Natalie and say, what have you done to assure, what progress can you give us against that voice of the child and the Think Family assembly, please? And I do think there is a reality recognition as well, is that as a local authority, because we have got schools and because we have got more involvement in children at early help and through child protection plans, that we have a longer time to establish relationships with the children, and therefore will have a better opportunity to get more information. It's right that Leanne says, that's great that the officers on the front line are going to be looking at what they're seeing, offering the opportunity. But let's be realistic, if the police have been called to an incident, we're not going to be, requiring the officers to make sure that they take off a child and interview them in situ. That's not going to work. So we have to be realistic about what they can do to add that value to the kind of the picture. If the child has said something, has done something, make sure it's recorded. Observe the child's interactions, make sure it's recorded. That's an appropriate, proportionate, good contribution to us understanding the child's lived experience. That's very different to what a social worker or a family support worker can do when they're working with a child.
But that makes sense. But if we have the longer standing relationship with the children, does that mean that there's a role for the council to bring that voice of the child into the other part? And is that,
And that's what we're doing. So through our audit activity, we're asking for the voice of, looking at the voice of the child. Where is that coming from? How are we doing that? Through our casework, you know, we would always look through our individual plans for children. So who's talking to this child? You know, we've got a social worker, maybe we've got a family support worker. We may well say, looking at a case just the other day, you know, the school have allocated a mentor to the young lad. And that's part of his plan. So it's a recognised that agency can help that young person have opportunities to talk to them about what their lived experience. And we'll do it case by case, but we look for that in our audit activity, as well as I say, in that feedback where we go to children and people and say, what was the difference that the partnership working made for you?
Thank you. Councillor Crockett, you had a question.
Thank you, Chair, and Councillor Highfield and Councillor Proctor are already stomped on my ground that I was going to ask you about the voice of the child and families. And it's really important that we listen to everybody, isn't it? And going back to the document on page 14, it says the reporting period on that one was significantly supported by the engagement framework from 2024 to 26, and it's directly impacted on the work of the partnership. So it's really encouraging that things have been highlighted. The only thing that I couldn't really see is how the partnership ensures representation from children of diverse backgrounds. So including SEND, special educational needs, disability, minority, ethnic and care experienced young people.
I think that's so that you may be aware of the multi-agency partnership that sits within the SEND arena. So particularly for those children, that is a partnership that works there. One of the directors for that and their service manager sit on my leadership board. So you know, we communicate cross service around the local offer, same with care leavers, same with unaccompanied children. So the contact that we have with children and young people in the different parts of my service will come together as we as the local authority, as the children's service, are listening and hearing what children and young people are telling us about.
It's really important that we get everybody involved, isn't it? And so how is feedback from children and families collected and more importantly fed back? So you said we did sort of scenario.
So for children and young people, we do, for those children in care where we're corporate parents, we do, you said we did. I think it's bi-monthly. We've got Ofsted in at the moment, so I just happen to have read both of the recent ones just 2 days ago, and they're great. You know, Councillor Owl might have more on that, but it's there. In terms of the wider family feedback, I don't think we do that in a public way. That's maybe something that we can think about doing when we look at, you know, the outcomes of our next report. Certainly something that I can think about for us as a service as well. So I'm not sure that we collate that. You said we did on a family basis. That said, we do it through the Parents for Change group that we work with, and you know, the co-production that we're doing with them on the single assessment, the self-assessment, the animations. We've developed a whole load of animation cartoons that take you through the child protection process from the beginning to the end. You know, working with them around what the words, what the language should be in those. So to them, Rachel Gillett, who leads that group, she does for them, like you said, we did. But that's not a public kind of document.
And again, you just mentioned the language, and you know, the language that we use, you use, any other group might use, is really important so that it gets the actual question or information across correctly.
Thank you. And sort of for me also, all of this, the voice of the child, etc., goes back to Herefordshire being a child-friendly county, and I think that that's really exciting. That provides opportunities for you know, all the partners to come up with ideas in how, you know, they their service area can actually make Herefordshire child friendly. I'm going to have to sort of keep an eye on the time, but I know that Councillor Davis, you had a question on equality, inclusion and anti-racism. There was a question there, and then Councillor Cornthwaite, you had a bit on funding cuts and efficiency.
Yeah, thank you, Chair.
Councillor Davis, yeah.
Yes, the question I was going to ask was on the Safeguarding Practice Review Panel report. It's silent race, racism and safeguarding from earlier this year. And I just wondered how that report has impacted the partnership. And also, has it made any difference to training and requirements that needs to go forward to staff that are dealing with such cases?
I can start some points on that. So what we've done as a partnership is trying to see how we can make sure that issues of race are really visible to us when we're doing things like audits. So one of the questions that we've introduced to our audit program now is whether the family's culture and identity have been considered and understood by the practitioners working with them and how it's influenced the way that they worked with the family. We've also been looking at one of the findings from that review was specifically around that report was specifically around case reviews and how issues of race and racism are explored within case reviews. So we're doing some capacity building work with our case review panel members around how to kind of help to understand how to explore those issues when we're doing analysis around case reviews to help to improve some of the learning that we might gain from those exercises. And jointly with Worcestershire, Herefordshire and Worcestershire are doing a joint self-assurance or self-assessment exercise. So we pose a couple of questions to partnership organisations across both areas, asking how well we're doing across different findings from that report. So that's underway at the moment, and that'll inform, I think, future work.
Okay, thank you.
Thank you. Does that include also work with Gypsy and Roma families? Does that because obviously in Herefordshire that's a sort of quite a large part of our kind of minority.
Yeah, so considering any kind of particular aspects of a person's identity, yeah, so any of the protected characteristics, including race, ethnicity, and those diversity issues.
Thank you. And Councillor Cornthwaite.
So under funding cuts and efficiency, a couple of questions. How is the partnership preparing for potential funding reductions across police, council and health services, and what mitigations are in place? And how are police and crime commissioner and council funded programmes being aligned to maximise efficiency and reduce duplication?
So we're actually, Kevin noted it earlier, but we're very much in the leaders of the four organisations that the ICB and West Mercia Police share, because they serve four local authorities. And at our last Lead Safeguarding Partnership Group, which is the group that sits above all of us, we've agreed the funding for next year and the split of that funding for next year. We have reviewed together as a partnership the business board. We have made some efficiency savings. So we recognising that everybody is under financial challenges, and our review, I think, made a saving, which all of the partners received a little bit of a share of in terms of going forward. So we've contributed, we've recognised that it's there, it's a challenge, and we've taken the opportunity to, just through efficiencies, really, to reduce the cost of the safeguarding partnership, and we've already agreed it for next year and the split for it. And in terms of the council and PCC funded, we jointly fund. So we have a joint part. We've had a panel that have reviewed all the bids. In fact, last Friday, the PCC lead, Gareth, and myself sat through and went through all of the final bids that had been recommended by the joint multi-agency panel, and we reviewed all of those to make sure that there was a good geographical split. We took into account the youth mapping that we've been doing around where do the youth services sit, where are our gaps in terms of both geographical gaps and perhaps gaps of the type of youth service that's on offer, recognising that not all young people want to do boxing, for example. And we jointly came up with an agreement of what will be funded out of that pot. And Gareth and I have agreed the funding pot for next year. So we've been able to secure for those people that are successful in their bids, we've been able to secure them an 18 months moving into 2 years rather than just the 12 months, which is the real challenge for some agencies. So we've committed funding and we've jointly done the work to go through the bids.
Thank you.
I was just curious as to whether public health funding streams can sort of become part of that potentially.
Yes and no. So there is a joint PCC and local authority pot that we've committed to, which is not statutory. It is something that we find the money for because we want to support the prevention agenda. And we agreed the criteria for that together as well. So it met both the PCC's criteria and challenges, but also as the local authority. The public health funding, which is also obviously within the local authority, that funds a very different group. But as a children's service, I work very closely with public health, and we are working really, really closely now. I'd say it's probably earlier days, but maybe 3 or 4 months into really starting to look at new money coming in. We're there, joint funding. We only literally last 2 weeks ago agreed the funding plan for the very recent grant that's come in around family hubs. So I sat with public health and we went through what our priorities were, using the Families First programme, using what we've got, using the youth programme, mapping, using all of that, bringing it together and looking at how we're going to meet the criteria also for the grant for the family hubs, for example. But as part of my own business plan and work that I know that I need to do, it's myself, the public director of public health, Zoe. We've agreed that we need to kind of sit down and look at what is currently funded, what is meeting the needs of the children that we as a children's social care service are seeing coming through the front door. How is it what's being currently funded having best value in terms of finance, but also best value in terms of the outcomes for children. So we're going to go through some of those commissioned services that we have got over this next 12 months, and obviously tie that in a timeline to when those contracts are up for renewal. So it's kind of it's an annual piece of work that we can do over the year as we time it when those contracts are going to come up for review. But a good example also is that we've had a situation recently where we had the death of two young people completely independently, very, very sad. But we looked to one of our commissioned services for substance misuse. We reached out to them. They are commissioned. I asked them to do some additional drop-in services for the children and people of Herefordshire. I asked them to do an additional reach out to those children and people that they were working with, and to provide some additional support to the staff in the care leavers teams. And they've responded really, really positively with that. But we will be taking that into consideration when we look at the recommissioning of that commission contract. So actually, did we need to do more? Because I had a meeting with the care leaver staff to look at what do you think we could do more of as we reflect on the death of these two young people, and they've come up with some ideas, and so I've got that to take into my conversations about when the timing is right to look at the recommissioning contract to make sure that we're incorporating that. So again, it's strategically, it's just making sure that we're pulling all the threads. We have the golden thread around the strategies and plans, but we're pulling all the things to make sure that one thing is informing the other. Ultimately, are we having the best thing for children and families? Are we providing enough support, early help, prevention to help them enjoy, a positive, safe life, really?
Thank you. Yeah, just one quick question, then I'm going to go to Councillor Powell.
Yes.
Councillor Highfield, you've got one.
I have about prevent. Only triggered by hearing a story this morning.
Can I just ask, because prevent is the next bit on the agenda. Is that right?
Yeah. Tina, it's really good that you mentioned substance use or substance misuse, because that's one of the big things that we need to look at as a collective with children, young people and adults. So I'm glad you mentioned that. And the other side to the public health funding stream, I'm sure you're doing it and talk community and other community resources, because, you know, there's a wealth of information and support out there with that.
Yeah, we have. When we've come together, we've come together with Emily from Talk Community, myself and Lindsay,
Perfect.
Okay, thank you. So, councillor Powell, I wonder if you'd like to put your penny's worth in before we bring this item to a close.
Okay, I will. So obviously this is scrutiny of the Herefordshire Children's Safeguarding Partnership, and there is local government association guidance for league members on how they engage with, and I use this term on purpose, local children's safeguarding boards, dating all the way back to 2016. I've been talking to the local government association about how do we, what do we do to refresh that guidance and my role with the Children's Safeguarding Partnership. And again, it's a bit like Ben's point. It's kind of declaring an interest, but I'm not sure that it is. Some of you will be aware that I perform the role of independent scrutiny elsewhere. So I perform the role elsewhere that Kevin provides here. So I'm always really cautious about not stepping over, you know, the boundaries between those particular two roles. But inevitably, because I perform that role of scrutiny elsewhere, it does give me and indeed with some of the partners or all of the partners who are here, it does give me the opportunity to kind of reflect on what happens elsewhere that we might be able to bring to Herefordshire. I don't make loads of suggestions because I don't think that's necessarily fully my role, but occasionally there's something quite useful that comes up. And I've just plucked some, because of Councillor Crockett's point about drugs, just plucked something randomly out of the air that I came across from elsewhere in the country. And it was a toolkit that had been developed, co-produced across the partnership. And it was with regard to parents who were using a particular type of drug, which may be problematic for their parenting. So shared that with Tina, and obviously Tina will reflect on what that might mean locally. The other thing that I've raised a couple of times nationally, and people go, it's quite an interesting point, we haven't really quite worked that out yet. And what is the role of the independent scrutineer and scrutiny? Because the scrutineer role has been different. I'm not sure anybody has particularly worked that out. But just to, I guess, focus on the bit for me, which I think is the strongest piece of work that has gathered momentum at pace, and that is very much focused on the voice of the child. You've heard what the different partners have said about that. Tina mentioned the takeover activity. By coincidence, we have corporate parenting board tomorrow, and there is a takeover element to the meeting tomorrow where care leavers will take over a particular section of the meeting. The last time we had that, it was focused on the subject matter of delegated authority, and those of us in the room were invited by the care leavers to answer some questions that they were repeatedly answered during their life as a care leaver. It was pretty sobering actually when you thought some really vulnerable young people were asked some really tricky questions and we'd feel quite awkward about it. And I'm glad to say they've taken about a piece of work and they're bringing that back to another corporate parenting board to move that forward. So in my view, genuine listening to and responding. I will remind you all that there is the opportunity to talk to care leavers at the Care Leavers Hub by negotiation. Obviously, you wouldn't want to overload that. So Tori Lynch would be the contact there, or Stacey Edwards. We have events. We hold Foster Fest and Children in Care events. Elected members often attend those and they are welcome. The Youth Employment Hub is another opportunity to gather experience. And then, of course, you will all yourselves be going to your local primary schools, but particularly on Councillor Crockett's point, I recently went to one of the local primary schools where there'd been some capital investment in an inclusion hub. So meeting the needs of children with special educational needs or social, emotional, mental health. And that gave me the opportunity to talk to some parents. A couple of parents in particular described the really positive impact the capital investment has made for an environment that has enabled their child to get back into mainstream education. And then just the last little bit about third and community sector. you will all talk to the thirdly community sector. They are really well connected into our children and families, and as Tina has described, that they are very involved in supporting families and engaging in early help. So they are a really rich source of, what's it like out there. And a specific example, we've been working, I'll say we, Tina and I have been working with HBOS with a view to co-producing an offer for children and young people, including the production of a roadmap to youth work, which is based on some work done by the Youth Provision Network. So some examples there of that broader work incorporating voice of the child sits alongside the partnership, I think, really, rather than me being seen to be interfering in the work of the partnership, because they quite rightly have their own scrutineer who provides that collective challenge.
Okay, thank you. Thank you very much. I think there's a lot to talk about, and we could probably talk all afternoon. And certainly, what we would like to do is take elements from the annual report to put into our work programme, so that we can actually do more deep dive. I mean, one of the education subgroup, for example, there's all sorts that sits within there. But thank you very much for coming. Thank you for the work that you're all doing on the much improved partnership, and thank you for kind of securing funding to make sure that this work can continue in difficult times. So do we have any recommendations from anybody on this particular item? Sorry, I haven't managed to keep.
That's okay, Chair.
Recommendation.
I've had one recommendation sent over, which I'll suggest. I think this stems from a suggestion from the Director of Children's Services, and it reads as given to me: partnerships consider explicitly reporting what partners learned from children and families and how it influenced policy. You said we did, and practice in its annual report. I'm really sad to go. It's showing I've got the screen. Unfortunately, it's a lot easier to read it out. Partnership to consider explicitly reporting what partners results learned from children and families and how it influenced policy, i.e. you said we did, and practice in its annual report.
You said we did is in slightly the wrong, I reckon, in slightly the wrong place, so it should be how it influenced policy and practice. Brackets, you said we did.
Yeah.
Okay, I'll check that.
Okay. Are we happy to take a vote on that recommendation? Yeah. Everybody for? Yeah. Okay. Thank you very much. Thank you. Before we move on to the next agenda item, I think we need to have a 10-minute break. So if we can just stop the live
Correct.
Thank you. Okay, so welcome back. So item 8 on the agenda is the pursue, prevent, protect and prepare item. This is for the committee to consider and review the response to prevent, which is a legal responsibility for public bodies. This report advises of Herefordshire Council to respond alongside other key agencies whose responsibility is to identify and support vulnerable individuals at risk of radicalisation, challenging extremist ideology and disengaging people from terrorist activity. Thank you very much. We've got 3 members of staff here. I think it would probably be helpful if you introduced yourselves and what your role is, and then we can take it from there.
Hi everybody, I'm Kate Thompson-Dixon. I'm Head of Resilient Communities based in Public Health within the Community Wellbeing Directorate, and my portfolio covers community safety and emergency planning, and therefore quite a large proportion of the counter-terrorism work.
Good afternoon everyone, I'm Vicky Leader and I am a Service Manager with Early Help, and I am Prevent Lead for Herefordshire Council, and I also chair the Channel Panel for Herefordshire.
I am Holly Powell, I'm Team Manager of the SAFE team in Hereford Children's Services, which covers exploitation and also prevent. So we enter the meeting from the Children's Services.
Okay, thank you very much. So we're assuming everybody has read the reports, and we're not going to have any presentation on this. So if I start the questioning, I think it will probably be helpful to go through the different P's as such. If I can just start by asking, so in terms of the letter from the Home Office and the action, is there an action plan to address the not met criteria of evidence and self-assessment of the prevent local authority assurance criteria? Sorry, does that make sense? There was the criteria letter from the Home Office, and congratulations on all of the sort of exceptional bits that you've managed to achieve. But there were some elements within there that were not met. And I just wondered whether there is an action plan to address those.
Okay, so all elements were actually met, and one was exceeding. So there weren't any areas that weren't met. So in terms of the multi-agency partnership group, that was met. We have a prevent board, which meets quarterly, so that was achieved. We have a situational risk assessment, which is updated after the counter-terrorism local profiling event. So that was met. We have a partnership plan, which is our prevent delivery action plan, which is also updated, and it forms part of our prevent board. We have a referral pathway in place, which was deemed exceeding when I met with the Home Office back in January. And we've added to that now, we've got a referral process, which looks at kind of any other support that we can provide, such as early help, and also a safeguarding response. Channel Panel was a separate standalone assurance process, so that wasn't covered as part of this process. The training programme was deemed to be met. We do have a training programme which has been expanded since. In terms of reducing permissive environments, that is part of our prevent board. It's a standing item on the agenda when we meet every quarter, so that was deemed to be met. And communication and engagement was the last benchmark that was considered. And again, that was deemed to be met.
Thank you, Vicky, and apologies. I don't know what I was looking at when I saw the bits that weren't met, because I can see in the report there that they're met. But thank you for clarifying that, and congratulations on meeting all of those. I have to go back and see what I was reading, but that is assuring to know.
I think there's an appendix at the back of the letter which shows the different criteria, so it may have been that was possibly confusing.
Yeah, that's great, because I was looking at things like the partnership, the local risk assessment process, and the referral pathway. But as you just confirmed, that those have all been met. So yeah, there's obviously good work happening in Herefordshire in terms of that. Right, councillors, Councillor Proctor first, then Councillor Highfield.
One thing that leapt out of the report, and to me was there was some discussion of us historically things improved when the coordination role moved to children's services. We have now moved it out to children's services. So can you talk us through what that decision, why did it improve when it went to children's services? Why is it a good idea to have moved that role out to children's services again?
I think to be honest, historically we weren't the people that were part of the decision to move it into children's services so much, but certainly so it was kind of hard to explain the rationale for that. Certainly there was the development of Kate's post, and that made sense to us in terms of having that placed under that new role, in terms of that team. But we absolutely understood the importance of making sure that we got children's services with, you know, a big footprint within that service as well. So it made sense to us that it should be there, and maybe not explaining so much around why it came out, but it maybe certainly Kate's role didn't exist before, but didn't previously exist. And what I would say is, you know, I know you only just started the questions, and we've just had a session on partnership working, which I think was, you know, a good example around that partnership working. If there's a brilliant example of partnership working across directorates within the council, this is it. I think, you know, just because we've moved it out of children's, Kate's role, but Holly and Vicky and the level of work that they do together, having distinct roles, but really, really, truly combining them under this wider Prevent agenda has been exemplary. Hence the outcome of the Home Office review, and I think it's fair to say.
Okay. Councillor Hayfield?
Yes, thank you very much. My question is there was a news article this morning on the Morning News about they claim in that of those people referred to Prevent, up to 90% are rejected, not accepted through the triage system, because for the reason that they do not have an apparent ideology. And since Prevent was set up to deal with extremist ideology, they don't fit the profile of those that Prevent can deal with. So I asked the police superintendent just now outside, so those people who are referred, there's no suggestion that they're any less scary than the ones who are accepted. It's just that they don't seem to have an extremist ideology. And I believe Ruda Cabano, who killed those 3 girls, would not fit in the Prevent framework because he seemed to have an extremist ideology other than violence. So I asked, well, okay, those ones that are referred who don't fit, what happens to them? What system is in place to deal with them? And she doesn't believe there actually is one at the moment, although apparently there is work to consider it. So perhaps you can explain what's going on about a majority who are scary people, but are not fitting into Prevent.
Yes, thank you. I would say there is a lot of work that has happened already, and there's a lot more work to come following Southport. So Lord Anderson was appointed the interim Prevent kind of person to undertake the review. And that review was published in July of this year, and the Home Office are obviously looking at the recommendations from that. One of the categories that is kind of quite prevalent is violence fixated individuals, which would have been Axel kind of category. And one of his recommendations is that individual category would fit into panel space. So they're currently looking at that and kind of developing processes around that. There has been a lot of work since Southport that's been undertaken, and a lot of changes that have come into fruition since that. We see a lot of changes within Channel. So I think there is work that's been undertaken. There's more work to be done, definitely. Don't know if you wanted to.
Yeah, I would just add to that, that you are not asking that question in isolation, and that question is being asked back to our Home Office advisors from us as Prevent Board as well, to understand how can we best support those individuals who are not presenting with an ideology other than extreme violence. I think there's a couple of things to note in the screening. So the initial referral will go in to be triaged by CT police, so we wouldn't necessarily receive the information if it's rejected at that point. It also doesn't mean if it's rejected at that point that the person cannot be referred in again. So some of those rejections might be that there's a lack of detail as well that's needed, so they might go back in again. Once the referral reaches us at Channel, even if it's not adopted as a case, we have, I think, more robust procedures in place in order to make sure that we are supporting that individual and their family if they are a child or young person, regardless of whether or not they're adopted at Channel. So it's a little bit more robust when it gets down to that more local level for us.
And that's something we particularly put in terms of Vicky's service as early help, and also Holly's service, so that wherever any young person wasn't accepted, they're a child, that we have that automatic review around the early help assessment of the wider issues and needs that might be existing, and link directly into Holly's service as well if we need to around the exploitation and Get Safe. So
we
I think
do screen at Get Safe as well. So we also screen at the same time with some children that come through if there's other concerns around contextual safeguarding. And we will adopt within our team as well for a Get Safe worker. So while they're going through the process of that until they come to Channel Panel, we have already started working with certain children to do preventative work and also wider contexts around contextual safeguarding that might be linked missing children items as well.
And are you comfortable that, given that many of these that are rejected are just as potentially dangerous as those who are accepted? It's just the ideology question. Are you comfortable that the alternative arrangements that are put in place are as robust and as well supported as the Prevent programme?
In terms of our local procedures, when it reaches us as a local authority.
Well, looking at the past, it doesn't seem they were, but Ruda Cabana was rejected by Prevent perfectly correctly, but whatever was put in place doesn't seem to have been any, because I'm quite impressed by Prevent, to be honest. It's not perfect, but it's pretty impressive. But there's approaching 9 out of 10 dangerous people who are not being reported to, not being dealt with by Prevent. They're being dealt with by something else. So I wonder whether that something else is sufficient. Is it robust enough? Is it skilled enough?
We've got very good youth justice programmes as well, that we also refer to, and there is the Prevent officers within the police over at Lembury who do really, really valuable work as well for offenders, for perpetrators, for children also, that antisocial behaviour and things like that. So they've got really good programmes around that as well.
I mean, I think what we're describing is that locally we've got it as good as you can get it, and we would never be able to give you the assurance that somebody that's not there. But as they've said, you know, nationally that criteria can be very limiting, particularly when it's adults and it's not children. We've got a bit more robust intervention there, and we can re-escalate those children, as you know, the team have said, if we need to, back to that referral panel if we gain more information or concerns. But you're talking about a national concern around that more restrictive, which of course is described as something we need to address. But locally, and certainly for children and young people, I think we're as robust as we have.
Okay, I mean, nothing else I can ask, and I'm very happy with your very frank answers. I might consider later that we suggest, whatever little influence we have, that the definition that they use for Prevent might be widened, as it's apparently being considered already.
Yeah, I think we could anticipate that it will be broadened, and that seems to be the direction of travel with that conversation, but it hasn't been fully confirmed yet, and that may be something that we can bring back to you as an update at a later point when the definition, or as and when the definition is changed.
Thank you very much.
What I will add to that is, as I mentioned, Lord Anderson's report, one of the considerations within that was what's referenced as a below thresholds panel, which is happening in other local authorities, not Herefordshire. But that is for individuals that don't meet threshold to get to the channel panel. So it's an alternative to Channel for those that maybe don't present with the ideology that is required to get to Channel. So I don't know what the outcome of that, because that is going to be, that is a pilot currently, but they'll be learning from that, I have no doubt.
Councillor Proctor?
I just wanted, this is really just checking my understanding of the situation. So if a referrals go to the police, if they are passed locally, then there are arrangements in place. They might be, they might go through prevent, they might go to early help, they might go to get set. So that all sounds fine. And reading this complicated flowchart, it seems that if the police have safeguarding concerns, they would also refer them. So potentially we're talking about an unknown number of people who don't meet the prevent, but the police don't identify any other safeguarding, and presumably we just don't know how many of those young people that might be a very big number, a very, very small number, but we presumably just won't know that. But
we do have information presented to us at the counter-terrorism local profiling event and the report, so we do get the local information. But yes, we don't hear about the prevent referrals as they come in, unless and until they hit Channel Panel. And it's the police's decision, the counter-terrorism police's decision. They have to make a Section 36 decision, which determines that there are reasonable grounds that that individual, which may be a child, it may be an adult, is vulnerable to being drawn into terrorism, and actually that Channel Panel is the right risk level for them to be presented. So it is completely the police's decision to present a case to Channel. It is then the Channel's decision as to adopt that case. So we have to be satisfied that that individual is being drawn into terrorism. And we also have to be satisfied that we can devise an action plan to reduce that risk.
It might be helpful to add that we are supporting the facilitation of training locally as well. So our CT policing colleagues deliver 2 synergy events a year. So there's that training opportunity and others that we are developing, which part of which is very much focused on how to make a referral into Channel and what kinds of information you need to include there. And the event that we had a couple of months ago was really well attended. Lots of professionals from the county attending, and really went through that step-by-step process of what information you need to include in that referral to ensure that it can be properly triaged. Because I think actually the feedback from CT police is a lot of them are rejected because there is just a lack of information included in the referral itself.
Yes, Councillor Davis.
Can I ask, on the prevent referral system, how are we meeting our targets? I mean, are we meeting all the timelines consistently, or are we having issues doing that? I know you said you've got quite a bit of success there. I was wondering if we had any issues or concerns over the, the various timeframes of triage, 5 working days, etc., etc.
Yeah, so I mean that is the police time frame, which we don't have any oversight of. The 5 working days is their triage assessment. They do all of their triage and deconfliction within those 5 working days. If it then moves forward to the information gathering stage, again that is their time frame. The police, and they have 20 working days to complete that assessment, which is obviously a bigger assessment. It is an information gathering exercise as well. So the local authority receives their request for information, which is then shared with the Channel Panel representatives. They have 5 working days to send that back. So we don't really oversee that time frame as in terms of the local authority.
But do you get any feeling for how we're achieving, or how they're achieving that? I mean, are we meeting these criteria? That's what I was sort of after. I don't know whether you get any flavour for that at all.
To be quite timely, I believe.
We certainly haven't been given any information that they're not meeting those timeframes. I think that's probably the limit of the assurance we could give around that. It's because it's not routinely reported to us, but we haven't been alerted to any delays.
And if I can throw in a second question, purely on the numbers, on the report, there was West Midlands information as well as national information. How do our numbers reflect on the West Midlands or West Mercia area of operation. Are Herefordshire counties small, large, equal? You know, how does the split work? Do we have a significant number then of potential?
So I think you could, and it's difficult because we can't obviously share that information to give you the full scale of it, but I think you could anticipate the population size in Herefordshire is reflective of the numbers that we see in any of our referrals or acceptances through channel panels. So you're going to see larger numbers in more urban conglomerate areas comparably, and often, regardless of what it is we're trying to compare, Herefordshire's numbers often look quite significantly lower than our neighbours across the West Midlands region or even within the West Mercia footprint, just purely because of our size and population.
Rurality. Thank you.
I think one of the sort of questions around that also is sort of what those trends look like in Herefordshire. So it may be completely different to other parts of the West Midlands, but you know, as Herefordshire councillors, what should we have on our radar in terms of radicalisation trends?
So those that are highlighted in the report in terms of the predominant trends throughout England and the West Midlands would be reflective of the predominant trends locally for us as well.
That's the same. Okay, thank you. Anyone? Yes, yeah. Councillor Crockett.
Thank you. Nice to see you all. I'm going to carry on with the prevent side of the 4 Ps and just ask you how the online risks such as gaming, social media, encrypted channels, how are they being identified and addressed across schools and youth services? That's the first question on that.
So online vulnerabilities are certainly part of our prevent delivery plan. So through the prevent board each quarter, Kate as the chair will be seeking assurances from the board members as to how that's being kind of addressed through their organisations. So that happens. In terms of school, unfortunately, Neil Crawford wasn't able to be here, but I know that he is doing a lot of work with the different school settings in terms of training and upskilling them to be aware of kind of artificial intelligence and all of the issues in respect of online radicalisation and vulnerabilities there. Others? Yeah, do you want to go on?
Yeah, so the SAFE team are delivering on training on online and also out in the community to all local schools. So we've offered it to all primary and secondary schools. We've had a really good feedback and uptake with primary schools at the moment. So we are targeting year 5 and 6. We send out local resources as well to parents and carers via schools. We do the sessions directly. They're very interactive with the young people, and we've been asked to go back yearly now to do the cohort of year 5 and year 6. And we are just going into doing secondary schools, but we also co-work it with Catch 22. They do school programme training, and also the CE police team. They have got online exploitation training for all professionals as well. And the members of the public can also log on and join those sessions. So I do think we raise awareness with our local schools in all the localities, north, south and central. And we send out any relevant information packs. So we've just had an update of all new online apps that the children can access to make parents aware of different apps that they can download, which may be a risk to online perpetrators. So we've just disseminated that today, actually, because that's an update. So we do keep it quite updated to all the schools and parents and carers of the local area. So I think we are quite involved with education.
So the numbers of schools that are participating, is it good?
Yeah, we've had a really good uptake in Central and North and Ross and Wye, and they've given really good feedback to our team.
So are there areas in Herefordshire that you're going to target to, to get them on board with this? Because it's really important, isn't it? And getting it over to year 5 and 6 you know, in their level way, I think is a really good start.
Yeah, absolutely. We attended the DSL event, so we had all the Herefordshire DSLs. We have like a monthly coffee morning, and we went and presented our Get Safe and our opportunity to deliver that training into schools, and we had really good uptake. We've had 2 requests this week also for schools to book in with us. We've got some of the new year coming up. We've got one in December. And we also go out and do community events in all the different localities. And that is situated in schools as well. So we've just done an Earl Mortimer event. We've got one tomorrow in Ross and Y at John Curl. We've done one in Hereford. We go out to all the different areas. So it could be Kington, Ledbury, Bromyard. Yeah, so I think we do target all the schools and areas.
So do you think it would be an advantage for you to send out a call to all ward members, you know, to say this is what we're looking at in the county? If any of your schools in your ward need further information or, you know, support,
Absolutely. That'd be really good.
I think it would be a really good communication channel.
We also have education and enter our Get Safe meeting, so our screening meeting on a Monday. So they're always in there for our referrals coming in, and our missing meeting as well for children. So any information that needs to be passed to that local school or a concern in a local area. So any intel from police, because we have police in that meeting, it does go straight to that school.
And again, getting the police involved is really important because it breaks down that barrier for police and children. If the police are getting involved and making a presence in the school, they won't feel intimidated by.
They have been doing workshops. So the child exploitation police in Hereford Police Station, they've been going out to local schools as well, doing workshops.
I know when I was a child, I was scared to death of the police coming in, but now that I'm an adult, I'm not so worried about the police. No, not at all.
Can I just add as well? So we, in January, I'll be submitting an application for preventing radicalisation bid. We're going to do that through the Prevent Board, and its specific focus will be on online exploitation and targeting certain schools within Herefordshire, and looking at support and training for parents and carers, as well as the teachers and the young people themselves. So that will be our focus for the new year.
Can I just ask how you would be, what evidence you'd be using to target specific schools? Is that based on intelligence or?
Yeah, so one of the things that we've been doing in very recently, and it's not a finalised piece of work, is looking at all of the schools in the county and trying to decide how we best communicate information around prevent duties, information, advice, where to get in, where to find information, how to make referrals, key contacts, etc. And we've kind of devised a list that's got a standard and enhanced here. We want to ensure that those communications are quite broad across the CT profile, so we'll be able to communicate information around Martin's Law, for example, as well as things particularly pertinent to prevent. So we're devising an annual newsletter that will go to all schools. That will include some links to information, where to find Home Office training guides, how to make referrals, who to contact locally, etc. And then those schools that fall into the enhanced tier, or a recommendation is that they're in the enhanced tier, we'll have kind of pre-reserved slots on our training events. We'll be targeting them specifically to come along to those synergy events, webinars, etc. In the main, they have been chosen as enhanced predominantly because of their size profile, because that fits with some of the other legislative requirements around Martin's Law, for example. And there is other local intelligence that we're able to use to specifically ensure that we're getting those targeted messages into the right areas in the county.
Councillor Proctor, you had a question?
So everything that Holly described sounded great, but it's our job to go, but what else? So the sort of one thing that occurred to me is, so that's very schools focused, which makes a lot of sense, but what about home educated children, people from GRT families we're not sort of fixed in the county? What are we doing to share the knowledge with them?
So that work that we're doing around schools' annual newsletter will be feeding into the newsletter that goes to home educated families. Rather than give them something else, we will add into that, and that we're working with colleagues on how to best target that. There are some other things that we can direct parents to. So, for example, our Solihull parenting training programme, which has got a module for teenagers and older children, specifically goes into online. We'll also need to explore a little bit more some of our work with health visitors and school nurses as well, because obviously our health visitors go into children and young people's homes, so we can make sure that they are also furnished with all of the relevant information. So I think it's a bit of a work in progress, honestly, but it's not been forgotten that there are those other children and young people that are not necessarily in school.
We have also within safety done training in the hospital, in Hereford Hospital recently. So we've been on the children's ward and A&E, training the practitioners, the nurses and the ward staff as well, for signs and symptoms of contextual safeguarding, and that includes prevent as well. So they've got all the resources.
And the only other thing that occurs to me is kind of youth work, uniform youth work. Is it appropriate to try and bring them in? Are you already providing that training to
Youth workers?
Yeah.
Say so. Yes, so they attend child exploitation MACE 2 meetings, so they're up to date with local knowledge as well. We've got very close links to like youth projects such as Close House in Hereford. Yeah, they're quite intertwined with our team. Can I just clarify sort of the Get Safe team and Catch 22, the different sort of work that those two teams are doing, because sometimes it feels like there's a kind of crossover. Yeah, so we work with children from early help level up. So we work with children up to 18 unless they're a care leave, and we work with until they're 25. So I've got 5 safe workers within my team that do the direct preventative work. If that's when a child's on emerging, moderate or significant risk. We also have the MACE meetings when they're moderate or significant, which is a multi-agency approach. The whole Get Safe that was launched in January 24 is a complete holistic multi-agency approach. So we have the buy-in from health, youth justice, police, we have early help, prevent, and they all come in to our meetings, they all review the children, and they're all part of this robust plan around the child. Sorry, what was the other question? And then the Catch 22 is that they're sort of the Catch 22 is a more lower intervention level. So if a child is not open to early help or services, they will go in and do a piece of work. They can do family support work. They will do child sexual exploitation, criminal exploitation. They cover the whole of the contextual safeguarding model. They also do in the training in schools as well. So we work really closely with Catch 22. They're also in our screening meetings. So if a child doesn't quite meet threshold for our team, so just starting to be on the periphery of risks and vulnerabilities, they will say, yeah, that's fine, we'll take this one. So they're in that meeting at the first opportunity to refer straight into Catch 22. Okay, thank you for the clarification. Councillors, any other questions? Councillor Cornflake, did you have a question?
Well, yeah, I was just looking, a lot of the schools have got security so that you couldn't go in, people couldn't go in there through, unless that they had identified themselves. Is that now the case in every Herefordshire school? Was one part, the first part of the question. The second was where the school, and I'll quote St Mary's at Lugwardine as a typical example. So on a Sunday morning, we as a church, Christian church, are able to go into St Mary's at Lugwardine and use it as a place of worship. And are places of like places of worship, because whether it's Christian worship or whatever worship, all types of worship could be targeted at this time. We see that. Are places like that, are you aware of them, and do we need to take any other special precautions about where faith-based activities are happening, whatever the faith, in premises across that would safeguard children, and do also have a link in to faith communities, i.e. churches, Christian or whatever, where you're making sure that the children that attend there are safe? Does that, other than normal safeguarding?
So in terms of, I think there's two slightly separate things there. So in terms of the building itself and building use, that is entirely down to governors usually of the school to make agreement with, you know, what the building is going to be used for and when. The responsibilities for them to ensure that the building is safe and used appropriately, kind of set out by Department of Education. Martin's Law has some implications for larger premises. Depends on the number of people present at a time, but those that is meant to be not really massively onerous. So it doesn't say, for example, all schools must have electronic gates or particular type of security. It essentially says all spaces that will have this number of people in must give due consideration to the risks posed from potential threats. So most schools and buildings will already be doing that. It's already part of their risk assessment. I don't think that we are routinely.
But it's not a local authority responsibility to do that for all of those buildings or all those schools. It is the provider of that organisation or that forum or that meeting that needs to be taking account of whether or not they can learn.
Okay.
So we wouldn't routinely be told.
And you've mentioned Martin's Law just a couple of times, just for the sake of those people who are watching us and don't know what Martin's Law is. Could you please explain how Martin's Law came about?
So Martin's Law was brought into force in April of this year. We've only recently received the actual guidance for local authorities that was published a couple of weeks ago, and that is essentially about security measures for buildings, public spaces and events. It's separated into events or that would have up 200 to 799 people are in the standard tier. 800 plus are in the enhanced tiers. There's slightly different requirements of event organisers or responsible person, which in some instances would be the premises owner. It varies, and the guidance kind of sets out exactly what it means by responsible person. To have risk assessed, trained staff appropriately and have plans in place for evacuation, etc., depending on the premises and the event details. So that's broadly what that is about.
Yeah.
Can I ask about that? So, for example, the Christmas light turn-on event, would that be subject to the requirements of Martin's Law? And you know, will that be happening around towns in Herefordshire now, where organisers are having to put in extra measures because of this law?
Yeah, the law is designed to be really non-onerous. So there is no specific you must put in place, etc. It is very much you must have due regard to the risks posed by. And so it is very much about event organisers considering what the risks are. And
they will already be very familiar with doing risk assessments for these kind of events. So it's just that additional, have you thought about this? And for a lot of these events, they will have thought about it, but for some, they might not have thought about it, and this just brings it into that.
So it'd be reviewed as part of our routine SAG process for events, which is the security advisory group that looks at safety advisory group that looks at the risk assessments for all events that are large events that are taking place.
So it's not bringing in a whole new sort of layer of anxiety for.
I think it hasn't brought in. I think there has been perhaps some anxiety about what it actually means, but looking at the detail that's been published so far, the emphasis throughout is for it to not be onerous or costly to event organisers.
And I think obviously for us, you know, our focus is on children and young people, so sort of how Martin's Law sort of impacts on events for them, I think would probably be sort of top of our concerns. So is that just an additional layer of risk assessment that needs to come in?
Absolutely.
Okay.
So the local authority's responsibility is making sure that people know about Martin's Law. There are already a number of private providers that have already set up where a school, not an independent school, a school or any organisation can reach out to them and commission them to come in and do a risk assessment, give them ideas on guidance on what they should be doing. So I've seen a number of independent providers that are offering that kind of facility to do, but that's why I'm saying it's not the local authority, unless it's a authority school. It's not our responsibility to do that. It is for us to make sure and help make sure people know that Martin's Law exists.
Just widely aside from Martin's Law, because you mentioned Safety Advisory Group, I'm interested in, if we're committed to a child-friendly Herefordshire, is there a distinctive child perspective on how risk assessments of events, how these things are managed, and is it a situation where understanding the perspectives of children and young people, and perhaps particular groups of children and young people, would be helpful to event organisers, and is that something that's already fed in the process?
Probably varies from event to event depending on what the specific focus of the event is. In the first part of next year, we will be doing a tabletop exercise with multi-agency partners that is actually looking at Christmas light switch on events. So that is to exercise our policies, practices, safety procedures. Have we got the right plans in place? And certainly that will consider the fact that we would have large numbers of people, some of whom will be children and young people. So there will be an opportunity for us to really test out what our current processes are, the robustness of those, and where they need to be improved. So, for example, whether we need to take into consideration specifically children and young people's views and experiences within those types of events. But as it stands, I suspect it's variable depending on the event being planned.
And then, so the committee's probably sick of me saying this, but in the recent COVID inquiry block was on children and young people. And one of the things that really jumped out was the guidance that the government issued about what was acceptable exercise was running, walking, that didn't include playing. And that led to, it would appear, the police enforcing against children who were playing because the guidance said that playing wasn't. And so I feel like that highlights that there's a risk if we don't listen and think about the issues from the perspective of children. And so I think would be really, I mean, it feels like Christmas light switch on would be a really good time to test that. But is it going to be explicitly, is there kind of explicitly in the design of that exercise some way of understanding what the perspective of children might be?
It's within our gift to support the design of the exercise, so we can absolutely ensure that that is included.
Yes.
This one might be for you, Kate, actually. I'm skipping back to the first P, pursue. I just wondered if any lessons have been learnt from the National Pursue activity, and have they been, if so, have they been applied to local safeguarding and resilience?
So the responsibility around Pursue very much sits with the police. So it's challenging for us to have all of the detail of exactly what's happening. We do get briefings, as Vicky's mentioned, in terms of those local profiles. You can see within the presentation from policing colleagues that national learning is being used to develop the local profiles and learning to be implemented locally. What was the second part of your question?
I couldn't see if there was anything specific for safeguarding and resilience.
What I would add is the information that we do get from the CTLP events. It is about the national context, the regional and the local context. And our CT policing colleagues do make recommendations. And that is what we take forward in terms of our action plan, which is a multi-agency agreed plan. So we do absolutely consider, because Pursue is part of that report, we get information about arrests, sentencing and convictions within that. So the recommendations do relate to all of that data.
So that CTLP basically is advising us on what potentially our local threats are, our vulnerabilities, and it's based on kind of regional and national information.
Right.
So again, it comes back to that question of, sort of what does it look like in Herefordshire? It very much depends on what it's looking like nationally. Is that, and regionally, is that what you're saying? I mean, we don't have a kind of Herefordshire profile that is sort of determines sort of what actions are taken.
We do have a Herefordshire profile, but we're not able to share the detail of what's in there. It is very much in line with what the trend analysis is for England and West Midlands as we've put in the report, but there isn't any further detail that we were able to add to that.
Okay, all right.
Quick one.
Yes.
You said that for the risk assessment for an event, the responsibility lies with the event organizer. Is that correct?
Typically, yes.
Well, I, in a past life, have done many risk assessments for major events, and it's quite a skilled and challenging process, which took training and experience. Many event organisers don't have that. How can we be assured that an event organiser is competent to come up with a proper risk assessment?
For those larger events that are going through our safety advisory group, the SAG process, that is supported by a number of professionals within the council who are able to comment on and help develop those risk assessments. Where they're much smaller events, more locally developed, then that is more challenging for us as a local authority to have oversight and assurance around the risk assessments for that. But I think one of the things that we've been looking to do, and we've recently developed our web pages around, certainly with regards to Martin's Law and Protect and Prepare, so that there is information to go to and that we can signpost organisers to get that advice and information on how to risk assess appropriately.
So, as I've been to a number of capacity as a councillor, a number of events of 200-300 people, which falls into the category. And I know that at least one of them, there was no risk assessment at all. They never even thought about it. And as I attended the event and I asked an event organiser, "Oh, should we have thought of that?" was the response. So I'm a bit concerned.
I guess the responsibility is incumbent on those event organisers to follow the legislation, and it's not for us to police that necessarily as a local authority. So obviously where an event is brought to us because it's of a particular size or location, it's going through our processes, then we can have some sphere of influence over what is risk assessed and how that's managed. But event organisers, whether whatever organisation they are from, it is incumbent upon them to understand what the legislative requirements are.
Okay, and how do we publicise that requirement to people who are the organisers, owners of premises or venues where
sort of events that Councillor Highfield was talking about, that parishes are probably always going to be aware of them. So
and I would assume also through licensing that, as events kind of apply for license, they're kind of directed to this sort of information. So one of the questions I had here was about how are equality, proportionality and inclusion principles reflected in all 4 strands of the piece, ensuring that prevent and protect work doesn't stigmatise certain communities. So I imagine, if there is a Herefordshire profile, that, potentially that community involved in that profile might be stigmatised. How do we prevent that happening?
I mean, in a sense, prevent works with everybody that is referred in. There is no stigma. It is a consent-based process, so we need to get the individual's consent to work within the channel space, for example. So yeah, it's open to everybody, effectively.
Yeah, it's difficult to think of examples of where communities would be stigmatised, really, because it's not necessarily going to be known that somebody's going through the channel process. So I think, you know, whilst we get their consent, it's obviously then treated confidentially with that individual and the agencies working with them. So I think there is not a huge amount of opportunity for
that
issue.
What happens if you don't get consent?
So if an individual doesn't consent to support from the channel space, that is when the referral kind of flowchart kicks into place, because we consider what other signposting we can do. Is it the Get Safe team would be able to offer that support? Is it we need to make a safeguarding referral? Can early help step in to offer that support through an early help assessment? But ultimately, the risk around terrorism activity sits with the counter-terrorism policing team. So there is the option of police-led partnership if we don't have consent within the channel space. And that is led by the policing team. And it's very similar kind of process with channel, but it's led by the police and they work with multi-agency partners, but they are then managing that risk.
The other question here that was on our list was how are children, families and communities supported to build critical thinking and resilience as a protective factor against radicalisation? Is that a piece of work that's happening in schools or?
Yes, I mean, it's certainly happening in schools at the moment through the work that Neil Crawford is undertaken. But it will also be kind of dealt with through my bid to the Preventing Radicalisation to actually take forward some targeted specific work for young people, their parents and carers, and also the professionals that are supporting them. So it is kind of an ongoing piece of work, I would say.
Because we do see sometimes that, you know, families that sort of all the evidence was there for them, but actually they didn't act on it in national cases. So I think that education for families is really important.
We have done within our team just to support our local schools and other professionals is we had a local school, Scrutiny. Their year 5 and 6 students supported our team to do a child and family friendly leaflet about the Get Safe team. That also has links to Prevent and multi-agencies on there. And that is something that we sent out to all DSLs, all schools, all parents and carers as well. So that's something that's more, it's in the child's voice, it's in the family's voice, it's very accessible. And the young people took really great pride in delivering and making this letter for us, this leaflet to go out. So I'd say that's something as well.
And that would be quite useful to see as councillors, just to see a copy of that.
That's fine.
Right, councillors, any other questions in terms of the 4 Ps? No, Councillor Powell, did you want to say anything about this?
I don't think so, particularly. It's a very specific and necessary niche area of work, isn't it? And I was just checking with Tina. We had this conversation a little while ago. It's actually not in my portfolio. It's in Councillor Gander's portfolio. However, of course, I'm taking interest in all of the work that is undertaken with children, particularly, but obviously their families more often.
Okay. I'm not sure if there's anything that any of you want to mention before we kind of conclude.
Just the one question around the faith leaders. So we did meet with all the faith leaders of Herefordshire. I think this was a question. And we delivered presentations with Early Help Prevent. Trying to think who else was there. So the Get Safe team as well. Yeah, so we presented how to refer in, signs and symptoms of exploitation.
Really, really well.
Prevent. Thank you. Thank you. Thank you. Yeah, we have met with the faith leaders and we do have those links.
Yeah.
And we hope to repeat that. We hope to repeat that.
That was a brilliant evening because I contacted your bossy supervisor, whatever, just to say how brilliantly you had presented that faith leaders in the city.
Thank you.
Thank you.
Great, thank you. Do we have any recommendations for this item?
Yes, we do, Chair. I'm just going to put them on the screen. I'm very sorry, so I don't have a usual system, so they're on the screen behind you here, Tina and officers. Sorry about that. These are the three recommendations. I'll read them out for the benefit of those. They're as follows. One, the chair of the Children and Young People Scrutiny Committee to write to all elected members of council, that's a full council, to advise them on the Prevent Get Safe offer to schools, asking them to ensure their local schools are aware of and participating in this work. Two, Hereford Council to brief elected members on current risks in Herefordshire identified by Prevent and on elected members' duties as corporate parents with regard to Prevent. Finally, the executive to consider how the specific perspectives and experiences of children and young people can be built into the design and delivery of emergency/civil contingencies exercises.
When you say Herefordshire Council for the second one, who do you mean?
I was going to say I'm always a bit queasy about recommendations or briefing, but we can, as councillors, we can ask to be briefed. We don't need to make a recommendation to cabinet.
But this is asking all elected members to be briefed.
Yeah, but we can. You know.
I mean, my suggestion is, I mean, as you know, ideally all members briefings, so I can make the all members briefing in December specific to this agenda item, if you can speak for all elected members.
I feel confident that if you do that, the members that turn up will be very pleased to hear.
Should I ask the Director of Children's Services? Are we happy with
Yeah.
that? Okay,
Yeah.
no problem.
If we can say, if it would be helpful if we said, yeah, the DCS through the children's all members briefings would be great. And then executive to consider how the specific perspectives and experiences of children can be built into the design and delivery of emergency civil contingency exercises.
Where did that come from?
Who's the exec? Yeah, where
I mean, I thought I heard Kate saying that wouldn't be a terrible idea.
I'm not sure. I'm just not sure who we mean by the executive, but that might be my misunderstanding. But it is possible for us to consider that in the design of exercises for sure.
It's just.
I think it would have consideration person probably have to come to you.
It's fine if that's what we mean. It's fine for it to come to me as an action. I have no problem with that. I'm slightly more concerned about the briefing on the current risks in Herefordshire, which is one of the stumbling blocks.
No, I don't read that as, so maybe the current risks words is the wrong ones. I read that as updating people on the kind of updates that we've given you today, not current risk. It's this.
Yeah, thank you. That's it.
Yeah.
I don't think asking for any competence.
Updating on to take out updating members on the 4 Ps, basically. Because I think it is important that it is the 4 Ps. It's that we'll do it in a much simpler version. But I think if you were to try and just do prevent, there would be a multitude of questions on, well, what's the other bits of what happens when and what happens when. I think that's the whole point of them kind of being together. I suppose when I read this, I'm the bottom one. I'm just thinking of the next email that we'll get in a couple of weeks, which is, can you tell us what you've done about this and write a report on it, please? It's not, it's, you know, you don't make a recommendation and then leave it with us. You will be asking for a report back on it. So I think it needs to be clearer in terms of what we're asking for, because of course it's something that you might consider, but I think you're writing that to receive an updated report on.
So I think it's probably, it is me who's probably most excited about it. And I do think we're only asking it to be, I mean, it could be addressed to the LRF or it could be addressed somewhere else if you like, and it's only a request to consider, but I felt in the discussion it emerged as a thing that would be worth considering. So and you know, executive might come back and say, we've considered it and it's too hard or it's not relevant.
I suppose the thing that's probably not happening as I'm reading it is that the executive group that we're giving the task to are not the ones that design the delivery of emergency and civil contingencies. So that's the discord for me, that these are the people that we're tasking to do the task, but they're not the people responsible for designing the delivery of emergency and civil contingencies exercises. So maybe you're right, it's not this executive, it's.
Might I suggest that you just put Herefordshire Council as a catch-all?
No.
No.
Well, okay, so they'll come back to name.
I can't see how, we talked earlier about voices of the child, but I can't see how that comes into the design of emergency civil contingency exercises. I don't see the relationship.
No, I'm not sure.
Would that be the emergency planning
So
team?
it's Ben's point, and this is blurring. I used to work in the local resilience forum, so this is the territory of the local resilience forum. So I think back quite a lot of years ago, there was an incident where there was a bus, can't really the term crash carefully. So going across the causeway at Home Lacey, the bus came to a halt and it was on the verge and the bus rolled into the field. And we did a quick debrief around it for a whole range of unusual reasons. Nobody actually triggered an emergency response, or rather the emergency response that you'd have thought. But the learning that came out of it was all of the children on the bus behaved responsibly, sensibly, they phoned their parents. And there was a bit of work done to say, well, actually, they showed great leadership there. And you know, what could we do to promulgate that kind of learning? So I can see where you're coming from in certain circumstances. You know, the three words when it comes to prevent activity are run, hide and tell. So is there something about what does run, hide and tell mean for a 5 and 6 year old who might be separated from an adult, different from a 17-year-old who's, you know, going to an event with friends? But I think it's a question that Kate's offered to pick it up, but is it answered by the other?
I think Kate's too willing there.
I don't think so. I think we absolutely are able to influence and shape the design and delivery of those exercises, whether it's through the LRF or for us more locally as a local authority with our multi-agency partners. One of the things that we have a responsibility for is the recovery element following an emergency, and part of that would be thinking about that community support, some of which might be specific community support for children, young people, a school in a particular area, you know, depending on what the incident is. And so there is the opportunity to consider the experience of children and young people there within that element of it. It won't apply to every single exercise that we do, but there will be some. So, for example, when we exercise the Christmas lights switch on, what we will be exercising is what happens if a vehicle is used as a weapon in one of those scenarios. We're not just looking at what we do in the moment, but we are looking at what we do as part of the recovery, which will be within the hours, weeks, months, year later. And some of that is very much about supporting the community to recover. And there would be space then to consider the experiences of children and young people. So, I mean, I'm content for me to take.
But that's a very different action, considering the experiences of children after an event or even before an event, to engage them in the design and the delivery of.
I don't think that has any necessary, that leaves it completely open to people who are designing the events to consider how their specific perspectives and experiences are brought in. So I mean, you know, I'm not precious about it. What Kate just described is what I was trying to.
So you're not looking specifically for children and people to be involved in the design. You're just looking for
No,
people
I
to
think
design it,
it's
take it into consideration.
Yeah.
So are we happy with it like that as it is now? Is that something?
I think it's probably for the Protect and Prepare board to consider, and I'm happy to take that action to the board. But I think it is for the board to consider how we do that.
Protect and Prepare board. So if we take community resilience manager out and put Protect.
I think that works, because I can take it to the chair, and that is where we are agreeing the exercises.
Okay, thank you. And I'm not entirely sure about myself writing to all elected members to advise them on the Prevent Get Safe Offer to schools. But I'm just wondering if that's something that can be put in the.
It's already in the school's newsletter, and we've said it's already there. I think that was another level of reminder, was it, to everybody that it's in the school's newsletter?
I can send you the Get Safe leaflet as well that you requested.
If you could send that to us and we can distribute it to all councillors. So do we keep that recommendation in as it is? And
I do task you to decide.
I mean, we will pick that up in recommendation 2 though, won't we? When we do the all members briefing, we will do the leaflets and the information about X, Y, Z.
We take out the first one.
We've already been assured that the first one exists already. They are being told already. And the third one, I still don't see how we build in children into exercises in advance.
Well, I think that was the point, that it wasn't about that, but that Kate would take it.
Requires different wording.
I don't think it does actually. I agree with that. I think it's fine as it is. Actually, it leaves it open for that. Surcharge doesn't be seen. I don't mind. I'm on the floor, mate.
If we take out the first one, let's take out the first one, and we'll take a vote on the next.
Do you want to do them individually?
Let's do them individually.
And can I also, what about the suggestion that we ensure that there's adequate publicity about the requirements of event organisers and also where they can get support if they need it in risk assessments?
I'm not sure that's a duty of children's services. That's, or indeed the council actually. I don't know. That's a council role.
To do with prevent, isn't it?
It's not specifically to do with the prevent strand, it is to do with protect and prepare, and it does form part of the delivery and communications plan for the protect and prepare board. So if that's assurance enough that there's already plans in place to think about our communications, then.
Okay. All right, so good. Shall we vote on the first one?
I'll read them out actually. That's
Thank
okay.
you.
Let's just so for the benefit of the audience. Okay, our first recommendation is as follows. The Director of Children's Services, through the all-member briefing, to brief elected members on pursue, prevent, protect, prepare, and on elected members' duties as corporate parents with regard to prevent.
Yeah.
Okay, excellent. Okay. And number 2, the Protect and Prepare Board to consider how the specific perspectives and experiences of children and young people can be built into the design and delivery of emergency/civil contingency exercises.
I'm abstaining.
They're both carried, Chair.
There we are. So thank you very much, and thank you for coming and talking us through all of this. I think that's the end of that. So it's just really the last item is the work programme. Thank you very much for coming. So item 9 is to consider the work programme for the committee, and we were asked also to look at the task and finish group, any additional work that we wanted to add to that. Does anybody have? Sorry. Okay, so the work programme. Any views on the work programme that anybody wanted to raise? I had one, which was really about neglect and the sort of way I understand how neglect and early health.
I'm stating the chair actually.
Yes.
I just want to remind everybody, obviously contained within the current committee programme is also your task and finish group work programme and early help. This is slightly different from other committees in that this task and finish group committee is composed entirely of you yourselves, the committee members. As part of that ambitious work programme supported by Children's Services to look at early help, Children's Services in partnership with other organisations have set up 3 road shows to showcase the breadth of community engagement within Herefordshire. The next of those meetings happens next Monday here in Hereford. So I do urge you all to attend that meeting. I'll send you a further invite out by the end.
Thank you.
And just comment that we've an astonishing amount of public activity helping all sorts of areas of social life. Astonishing. The only issue really is to improve the effectiveness of all those different community activities, because some of them are as effective as there's no shortage of people doing stuff for the community, whether young people or whatever it may be. So very impressive, but sometimes a bit discouraging.
Well, thank you for that opinion. However, this does relate specifically to our task and finish on early help. So, it would be great to come along. The first one was incredibly useful, very, very interesting. So we'll see you on Monday, but the point taken about that. So my point about neglect was sort of wondering whether looking at neglect actually fitted within the early help, within our task and finish on early help, because it seems that so much of the we talked about the neglect strategy around it at length, but we haven't specifically looked at it. So I thought that would be a good opportunity to look at how early help can address neglect issues before they escalate, potentially. And the other one is domestic abuse. That I'm not sure that sits currently within the draft, does it?
It doesn't.
No. Whether we should be looking at that
within the early help work. Neglect and domestic abuse are big topics in their own right. I don't think you can just add them in as a line within a group that you've already set out what it's doing, what its terms of reference is, what the meetings are going to do and achieve. That's already got quite an intensive plan of universal, targeted. What is the early help offer? How do people know about it?
Well, then we need to put them on our work programme, on the long list of our work programme, because they're not currently.
Oh, they are actually.
Are they on the long
yes,
list?
Yeah.
They are, yes. Happy to confirm that. So they're both in their consideration.
Okay.
Actually, I tell you.
Oh, no, not domestic abuses.
Domestic abuses, but neglect strategy certainly. So
neglected.
if I add domestic abuse to the long list, and we'll, at the moment, our work programme runs through to May, and that actually May's looking rather free at the moment. So we can always, I suggest perhaps at strategy meetings, we look to start to incorporate some of the other topics into your longer work programme from May and beyond. So
okay. So in terms of task and finish then, are we satisfied that what we've identified is robust enough for us to go on, or are we?
I think at the moment, certainly in terms of speaking with officers, plenty in there. There are some opportunities as well to meet with young people, care leavers, and with families as well. And I think some of that will emerge as you meet with some of these people and the opportunities that they arise. So, but at the moment, I think there's a lot in there. You are speaking to a very broad range of people, not only within the context of these roadshows, and some of those conversations at the meeting with Ross were very, very insightful, very, very fruitful. So I do think by the end of this programme, you will have spoken to a very, very wide selection of people that can offer their perspectives on this. Having said that, if you feel that there are other people that you want to speak to who should go along, by all means feel free to do so. It's quite normal for a task and finish group to run a little, as long as you make sure you don't just drift.
Okay, because obviously as you go through a particular piece of work, some issues might arise that you
absolutely, and this is a piece for task and finish group. You can just do that.
Yes,
Chair, just on the early help task and finish group, the first couple of dates have got 2026. Is that a typo? Is it starting this November?
It is. It has started effectively.
So it's
Yeah, they should be
November 2025 and December 25.
Oh, sorry, yes. You're right, thank you. Okay, so we can make those amendments.
No problem.
Thank you. Any other comments on the task and finish, the work programme, anything? I mean, we can talk about the work programme when we have the strategy meeting, what we can add to that. If there are things that have come out of the safeguarding partnership that you feel we should add to the work programme, perhaps you can get in touch about that. There are certainly a few things that stand out that would be useful. Anybody got any more comments on the work programme?
Just one thing we have on our topic of future scrutiny, youth provision, and I think I heard Tina talk about some youth services mapping. So that's something we want to look at. It's something we're doing support on, so it'd just be good to find a time to talk about that when we can be helpful.
And I think also that engagement work that you're talking about, that is really exciting, and I think that would be good to come back to this work
Program them in on the day.
Yeah. Okay. Anybody else want to? Any other comments on this? Is that on?
No, Chair.
Okay. All right. So if we agree the draft work programme for the scrutiny committee as attached, and this will be subject to monthly review as the basis of the primary focus for the remainder of the municipal year. So that brings us to the end of the meeting. The date of the next meeting is the 3rd of February, 2026, 2 p.m. I'd like to thank you all for attending. Can I ask that unless there's any formal business, then all attendees other than council members and officers, please exit the Plough Lane site. Now formally close the meeting. Please ensure you've taken all your personal possessions with you. And if you have hard copies of the agenda, please recycle them. Thank you. Can I just make sure that we are no longer recording? Right. Thank you. Oh.